Okay, so hi everybody. This is another episode of the Hotseat, and we're here with Dr. Sam, who is a dentist at Police Hospital. How are you doing, Dr. Sam?
Thank you.
So, Dr. Sam, our first question today: what does basic dental care entail? You know, there are some people that brush their teeth once a day, twice a day. Some people think it's imperative to floss. Others don't think it's always that's important. So, can you please enlighten us on that?
Okay, so basic dental care includes your oral hygiene habits and your dental visits. The oral hygiene habits are things you do every day. So basically, you're brushing. Ideally, you should brush your teeth at least twice a day.
Okay.
In the morning and then the last thing before you go to bed. People usually forget the last thing before they go to bed out of like laziness, or I'm tired, or it's not necessary, I'll brush in the morning. But when you don't brush before you go to bed, you're basically leaving a dirty environment full of food debris and bacteria overnight for all the damage to your teeth to occur. So then the next thing is flossing, because brushing doesn't remove the dirt in between your teeth effectively. So flossing basically involves carefully removing the dirt in between your teeth.
Okay.
And that usually should be done at the end of the day. So that you remove all the food debris from the day, like throughout the day.
Okay.
And the last thing, which is not really as emphasized, is rinsing your mouth in between meals. So a lot of the meals we eat, or we tend to eat, or the drinks that accompany our meals contain processed sugars.
Okay.
So in order to reduce the amount of time processed sugars are spent on your mouth, it's advised that you rinse your mouth with water. Like just drink water, wash your mouth, swallow, it doesn't really matter. You don't have to spit. Just to reduce the amount of time that the sugar spends on your teeth. And then the other side, like I said, is dental visits. So ensuring that you see your dentist at least every 6 months to make sure that you do your periodic cleaning. If there are any things that are developing, they can be arrested early, and then you keep your teeth in good condition.
That's new, actually. I haven't heard about the rinsing your mouth
Yeah.
after every meal.
Because the thing about dental care particularly is that it's about the amount of time the sugar spends on your tooth.
Okay.
It's not necessarily about how much sugar you take. If you are somebody who snacks a lot in between meals, you're at a higher risk than somebody who drinks a whole big bottle of Fanta only for dinner. Because even though it's more sugar, the time that the sugar spends on the tooth is lower. Because he drinks it for dinner, goes to brush his teeth and sleeps.
Okay.
You probably take a small sip of coffee with your breakfast, a small chocolate in between the middle of the day, then Fanta with your lunch. Like all these things are sugar exposures. So the more and the longer they are, the more damage they're likely to cause. So that's why the rinsing is important.
And I have a little sub question on the flossing.
Yes, please.
For the normal Ghanaian, or the average Ghanaian, if I should put it that way, what exactly should we use to floss our teeth? Because you know, not everybody can afford the little flossing. I don't know the name.
Dental floss.
Yeah, the dental floss from the pharmacy. So, what would you recommend? Should we use the local thread we have in the house, or something of the sort?
That is actually a very difficult question to answer, because ideally floss is specially designed to go in between your teeth without causing as minimal damage as possible to your gums, because the teeth are hard but the gums are very soft and very liable to get damaged. So things like toothpick, a lot of people that like subconsciously anything they eat, toothpick goes into their mouth. They tend to cause damage to your gums, and in further down the line cause all kinds of gum-related issues that now become a challenge to correct. So even though floss is really not that much expensive, because you can get, there are different types. You can get one that is just a thread, a big bunch of like floss thread, or you can get one with a handle, and you can get for as little as 5 cedis. And it's not like floss is something that you just need a little per day. It's not like something that you are going to drink or eat. So you just need a little length, you roll it around your fingers, and you can use that one length to go all over your mouth. You don't have to like tear a new one when you're going to the left side. You just use the same one all over. So even though technically it might be expensive for some people, I see it as an investment, because at the end of the day, you're saving yourself from future costs down the line, because dental damage, the longer it stays, the more expensive it is. If you arrest it quickly, you save yourself some costs.
So on to my next question. Ideally, how often should the average person visit the dentist?
Recommended every 6 months. The reason is, even with effective brushing, which most people don't do, because most people actually don't know how to brush their teeth. True story. We think we are doing the right thing, but we're actually damaging our teeth in most cases. But even with effective brushing, like the right technique, the right type of brush, a medium bristled brush, the right kind of toothpaste, there will still be some level of plaque buildup, dirt buildup basically, which needs to be professionally cleaned every 6 months to maintain optimal gum health and tooth health as well.
Do you have any advice for anyone who would like to improve the aesthetics, the general aesthetics of their dentition, yes, of their teeth? Because we have, in this day and age, just aesthetics carry the day.
Yes.
So like, if I don't like the way my teeth are colored or the way my teeth are shaped, what advice do you have to give me?
First thing is to seek professional help. So go to a dental clinic. I see a lot of things on social media about, no offense to anybody, this thing, teeth whitening products. Like, the thing about those things is they sell you something without they themselves even knowing the science behind whatever they are selling you. So then you use it ignorantly and you get an issue, and you still have to come back to a dentist to seek help. So first thing I'll say is go to a dental clinic, see a professional, let your teeth be assessed, let them point out to you what the main concerns are. For some of you, it might just be you need a cleaning. Once you do the cleaning, you're fine. For some other people, they may need specialist care for orthodontic reasons. For some other people, they might need a crown, but you wouldn't know until you go to a dental clinic. So go to a dental clinic, go with an open mind, let them assess you and then give you advice. And the thing is, wherever you go, they always give you options. So they'll say, you can do A, B, C, D, and then you decide but now you're making a more informed decision because you have gone to somebody who knows what they are doing.
And there's this general fear or stigma that people have about going to the dentist. People normally equate going to the dentist with pain, or you're going to have your teeth pulled out or something of the sort. So what do you think can kick out that fear amongst a lot of Ghanaians?
So there are two things. The first thing is, dentistry basically, you get the best experience when you go for early treatments. You get the most painless experience, you get the cheaper experience, you get the most beneficial to your health. Because the thing about dental conditions is they get worse with time. So even if you have a hole, if you come when the hole is just at the initial stage, you will go home in 20-30 minutes with a simple filling done, and that will be the end of it. If you take care of your teeth well, you never have any pain. But if you wait till it gets deeper and then you start to experience pain, then it becomes more complicated. Then you can't do a simple filling anymore. Then the tooth might have to be removed, which is the fear that we are worried about in the first place. So the thing about that fear is it's counterproductive, because it's keeping people from coming for early treatment, which is the thing that will prevent them from experiencing what they're actually afraid of. So the first thing I'll tell people is, go when you don't have an issue. Go for regular checkups. If you are in your late teens, early 20s and you've never been to a dentist, there is an issue. Because even if you think your teeth are fine, you still need to go for preventive reasons. Go and do a cleaning. Go and get your teeth examined. Let early issues be pointed out before they become painful. That's the first thing. The second thing is the concept of painless dentistry, which is basically the dental practitioners on our side doing all that we can to ensure that every visit is as painless and as comfortable as possible. So there are measures that are put in place by the practitioner, giving anesthesia, sometimes giving an oral medication, an oral painkiller ahead of the procedure. But those things are subject to each patient, what the patient will be doing, and practitioners' clinical judgments. But on the side of people seeking help, my advice is go when you're okay, go when you don't have any pain, go when you feel everything is okay, go and be sure that everything is okay, go and get your cleaning done, and then you can rest knowing that the chance of having that painful experience that most people hear of and are afraid of would be reduced because we are actively taking care of the health.
So ideally just try and visit the dentist regularly, regardless
of whether you have pain, whether you brush, even if you brush your teeth and it's fine, still make sure every 6 months you go visit your dentist.
Okay. So on to my last question for the day. How do we prevent some basic dental problems that plague not most, but some, quite an appreciable percentage of the Ghanaian populace? For example, people suffer with bad breath, halitosis, gum problems, dental caries, and the like.
So it basically comes back to what I was saying earlier about oral care habits, because oral health those battles are one from the preventive aspects easiest. So if your preventive actions, aka your oral care habits, are good, you prevent a lot of these conditions before they get to the stage where you might need special treatments. So basic things. Number one is toothbrushing with the right kind of brush and the right kind of toothpaste. Recommended brush for adults is a medium bristle brush. It's not too hard to cause damage to your gums, but hard enough to actually clean the dirt out of your teeth. So every adult should check the package of the toothbrush they are buying. It should be medium written on the pack. It's an industry standard for how hard the bristles are. The second thing is about the toothpaste. We recommend fluoridated toothpaste, which basically means toothpaste that contain some amount of fluoride, because fluoride helps maintain the tooth's hard structure, the enamel. It also acts as a kind of antibacterial effect to control the oral bacteria and other things that all in working hand in hand help to make sure that caries, the risk of getting caries is reduced, risk of getting halitosis, because dental halitosis, because halitosis can be caused by a lot of things, but basically when it comes to dental, it's caused by gum issues, dental caries, periodontal disease, all of which can be prevented by doing the same things. So brushing twice daily with the right brush, the right toothpaste, regular cleaning at the dental facility, whichever one you go to, all those things can help prevent almost all.
So Dr. Sam, just another follow-up question. Dental care is very expensive all over the world. So can you give our viewers, let's say, an average of the amount it would cost us for just a regular dental visit or a checkup to a government hospital, assuming the patient has the National Health Insurance card?
So the cost basically is very variable because it's facility dependent. So for example, if you go to Legon Hospital, they might charge you a different amount from if you go to 37 or Kolebu. What I would advise is, if you have NHIS, make sure NHIS is active, because even if it won't cover everything, to reduce your cost. Two, go for regular checkups. Go and do a basic cleaning. Let them find, if there's a hole developing, let them find at the early stage, because the simpler fillings are cheaper than root canals and crowns and all those things. So you save yourself cost by going regularly. Three, find somewhere that is close to you, because there's no point traveling, for example, from Legon all the way to Kaswa only to pay about the same thing that you would have paid in Legon, or maybe 50 cities different that you end up spending on transportation. So find a facility closer to you. If you're worried about cost, government facilities are usually cheaper. Downside being you spend more time there. So if you're somebody who doesn't have a very free schedule, you have to go to a private clinic because it will save you time. But then you are paying for that time you are saving with the additional cost. Yes. So go for early care, go for regular checkups. Because when you go and they check and there's nothing wrong, there's nothing there, you don't pay anything. You only pay for a procedure you're doing. At most you pay for a cleaning. Averagely in government hospitals here, between 150 to 250 cedis, you can do a cleaning. So I mean, if that's all you're going to pay every 6 months, I think that's fair. You understand? As compared to waiting till you have to do a crown that's like 1,500 or something. So early treatments, regular checkups. If you have insurance, some people, for example, I went to a private facility to do screening. We found out that employees there who had been working there for over a year had insurance that covered dental, and most of them didn't know. And then they had dental issues. Some of them had very serious dental issues, but they had been working there 5 years, 6 years with that insurance that they were paying for and not using it. So if you have insurance, take advantage of it. If you're working somewhere where your company offers some sort of insurance, call your insurance. If it's a private one, call them. Can I get dental care? Where can I go? I'm pretty sure at lowest to cover cleaning. So all those things will help you make sure that you're taking care of yourself without necessarily incurring the costs.
Thank you so much for your time today, Dr. Sam. It's been a very, very enlightening session. I hope our viewers learned a lot, and we'll see you another time on the hot seat with more information. Stay tuned.